YouTube's live, so you're live.
Okay. Hi, welcome to our Renew Advanced General Dentistry live streams. We're streaming right now. We're doing a stream on Twitch, Mixer, Facebook for those people out there. I'm going to be looking at the camera that is on YouTube Live. YouTube Live is our main platform, but we want to stream and get information to other people that are happier using other platforms. So, sorry for the complication if I'm not looking at you, but at least we get a direct feed. If you have any comments or suggestions or thoughts or anything you have a question about, I'm more than happy to talk about. Most of the time I talk about dental implants, full mouth rehabilitation, full mouth reconstruction problems that come up. This case here is a case that is a fairly traditional case. However, it has some choices to be made, and I think one of the values of watching our Advanced General Dentistry feed, whether it's live or not, is that you can learn a lot about how dentists make choices. And I would say that this particular case, this patient, and most all the patients that I see that come in have seen other dentists, and they start questioning why it costs so much. That's usually the biggest thing, is like, how come things cost so much? Or they want to just try to find it cheaper. Maybe they don't want to understand how come it costs so much, but is there another possibility out there to lower the cost? So not necessarily changing that treatment plan as much as like, do I really need the treatment? And this is a really good case. The reason why I want to bring this one up is because there's a lot of subtle unknowns here that the patient needs to know about given the situation, as well as treatment opportunities for the doctor. And I talk about that as treatment opportunities. Whenever a doctor, dentist in this case, dentist, it's a fee-for-service typically type of business. And in the United States, we have a capitalistic system for our healthcare system, which means that you go into that particular small business, whether you have trauma or an accident or ill health or whatever, and it is a money generating business. So treatment plans and opportunities for a dentist, for somebody that has an emergency, their treatment plans can be inflated beyond what maybe is necessary at the time, because the patient just wants to either get out of pain or solve the problem or something immediately, and typically they're more apt to spend money without thinking about it. So I don't want to go down the path of being negative about dentists in particular or anything, or any particular dentist. I'm just thinking that this is what the patient is dealing with when we mix capitalism and healthcare together. There's going to be friction, but many systems always have friction. If you have a socialist system, still going to get friction. So you're going to get friction no matter what, but here's the friction we get when we mix the two, healthcare and capitalistic ideas, with somebody's misfortune, you know. So we're going to talk about this young man that had fallen. He had a seizure, fell on his face, broke his nose, but cracked his 4 front teeth. And you can see right here, he's got a very chiseled front teeth. He broke this tooth in particular in half right here, and all of this is chipped away, and his canines look pretty good. Those are the eye teeth right there. So he wants to know, what is it going to take to fix this and get his smile back? Well, this had occurred approximately 4 weeks ago from this picture, and he doesn't have really any major symptoms. So the first question I asked him was, does he have any particular pain associated with any of these teeth? Anything that has abnormal swelling, pus, looseness of teeth. He has fairly stable teeth right now. At first, of course, the teeth were uncomfortable, but now he doesn't feel that there's a lot of discomfort. There's no hot and cold sensitivity. And what I could tell from the x-ray, and we're going to look at that, I don't see anything very definitive except maybe in one tooth, and I'll show you that, where there's some inflammation. Now, as I started talking about this from referral base, or from patient's perspective of what are they coming for and what are their treatment options, but also the idea of an opportunity that a dentist could be presented with, he had already explained that he had seen another dentist, and the dentist had suggested that immediately those 4 teeth need root canals and post buildups and crowns off the top. Well, the patient is asymptomatic. I can't tell that there's anything out of the ordinary that I would actually recommend a root canal at this point. Now, the reason why I'm not recommending a root canal at this point is because I don't have enough evidence to suggest such. I don't have evidence in the x-ray, and I don't have evidence from his examination to say that these nerves are dead or dying, or that actually require this. His nerve can, withstand a certain amount of trauma, a certain amount of inflammation, and it seems to me that these teeth are still vital and that they are going to survive. The big problem for me is that this is extra treatment if this patient decided to go with the recommendation of the first dentist that he saw, that would now have root canal treated teeth. He would double the expense of his treatment, and then he would have a lifelong problem with those teeth. When you do a root canal to the front teeth, you devitalize them. It's basically taking the nerve away. So in all of these teeth here, you have a canal, and that canal is where the nerve goes through and then goes up to the apex of the root socket and comes out. Well, I don't see anything up here to really warrant that those nerves are dead, and he was having some signs of vitality to those teeth. And so if we took the nerve out here, that means that the rest of the tooth becomes very brittle, and front teeth are very sensitive if they become brittle. If they become brittle, the neck of where the crown or the veneer meet is typically where the tooth breaks off, and that's usually right at the gum line, and now we have an extraction event. Now, here's the one tooth I singled out that looks more sensitive and has more issues from the trauma. And it's because what we call the facial plate, the bone across the front, got very stressed when he hit on his front teeth. I just can't even imagine it. It's like, it's like I used to skateboard a lot when I was younger. And the fact is, I was terrified of falling on my front teeth. So here, all of the front bone is very, very limited across the front here, and so he stressed that out, and maybe there's going to be a problem with that in the future. I think it's too soon to tell. Many people in three-dimensional viewpoints don't have a lot of bone across the front. He still has bone on the sides and on the back, and he has a ligament attachment that's going to keep it in place. The second time he falls on his front teeth, there might be a bigger problem where the tooth actually comes out. So I warned him of that, and unless he wears some sort of mouth guard or something 24 hours, I don't know how he's going to safeguard himself if he passes out from a seizure event. So it's going to be an issue down the road, but in this case, this is a restorative issue where we're looking at maybe 4 crowns or 4 veneers, and the root canals can always be done, but they cannot be undone. So we want to make sure that we don't end up over treating something prematurely. And certainly we're not going to be extracting these teeth either. We want to wait until there's really something more to be seen or more to be had when we actually want to look at some sort of extraction process. Outside of that, the rest of his teeth look pretty normal. He was asking more about his lower front teeth, And here comes more treatment planning. So his treatment on his front teeth, let's see if we have a better picture here on his lower front teeth. They're a little out of alignment. Now here's a judgment question, whether or not he should do orthodontics on the bottom. Now he could do traditional orthodontics on the bottom to bring his teeth back into the arch appropriately, or he can do the clear braces type of orthodontics, which you know as Invisalign or Smile Direct Club or Clear Correct, or a number of other companies are out there trying to do clear braces. And his question to me was, is he a good candidate for that? Here's where my expertise does not hold up. I don't have a lot of experience with orthodontic procedures. This is a pretty straightforward, simple one in my mind. He's a young guy and only needs a certain amount of spacing. So I would think that Invisalign or the Clear Corrects or the Smile Direct Clubs should be able to take care of this. But the only way that it can actually take care of this is by moving the other teeth forward. So here's the problem. If he is already biting really deep and close into his teeth here, if I put veneers on the front teeth and then he does orthodontics and they're not done to the point where there's space or some room away from the upper veneer part, he can now crash his veneers off on the uppers from the lower teeth, smashing into the bottom. So that smashing event is the problem. So he would need to make sure that whenever we're going to do the work on the top, but down the road when he does orthodontics, I was saying it might be good to slenderize in between these teeth. You can shave off in between the teeth, you gain more space around that arch. So now the teeth don't have to be pushed out on the bottom, possibly interfering with the back of the uppers, and now they can kind of fold inward more adequately and fit his arch and his lip line and other things. So it becomes a more future issue as he wants to kind of improve his smile and do orthodontics and things like that. But his immediate concern right now is just fixing his smile on the upper front teeth. He's a really good candidate too, because in this particular opening, he shows more lower teeth than his upper teeth. And so as a problem on my worksheets on my risk assessment, he's a very high green on the lip line because he doesn't have a lip line that's really high where we see gum tissue and things like that. And he's a great candidate for most things cosmetic. And I think just the upper four teeth, his teeth are a little bit yellow, but that's easy to fix. You just do some bleaching on this case first, see how his natural teeth will bleach out to try to match the wider porcelain teeth that we're going to be adding back. He's actually elected not to do veneers, which are all porcelain restorations, and essentially explain that as glass across the front of his teeth. He's electing to do a restoration called porcelain fused metal. So those porcelain fused metal crowns, I can do a full circumference, more sturdy, stronger around the tooth, holding it in place where he won't knock the teeth or the veneers off as easily, and they're not as cosmetic, but he's not as concerned about the cosmetics on the front there, but he's concerned more about longevity and strength, and so that will add a little bit of strength. It'll add a little more trauma to the teeth, but there's a lot of trauma that these teeth have already taken, and hopefully in the near future, I would say in the next 6 months to 12 months, if he doesn't need any root canals from this experience, I hope that he will never need root canals on his front teeth. So that's all we have right now for this live stream case. We'll get back to other advanced general dentistry topics. Like I said, tune in. We try to do everything on Saturdays. We will also be doing a dry mouth doctor segment that we will be doing also on these same channels, YouTube, Twitch, Mixer, and Facebook. So we will be doing those in the near future. We have different things coming out. We have some rinses that will be coming out for dry mouth cases, anti-cavity type things.